Basically, we're looking at young women who have a somewhat rare form of heart attack, which is where the blood vessel actually splits open or tears instead of the usual sort of buildup of plaque that ruptures. And these young women are often very physically fit and very active before their heart attack happens. But there was very little that was known about this, and so we decided to look at women who'd had this type of heart attack from a spontaneous dissection and compare it to women of the same age who had a typical type of heart attack related to the usual risk factors and plaque rupture.
A lot of the women that we see in clinic tend to be a lot more physically fit, as Melissa mentioned, and they don't have the risk factors that we usually see. And oftentimes what happens is they have their heart attack and they appropriately get referred to cardiac rehabilitation. So uniformly, cardiac rehab is indicated for anyone that has a heart attack. But most of the patients that are seen there are usually your typical man or woman in their 70s or 80s whose functional status is not like these women. So they would go into cardiac rehab very demoralized, feeling like their functional capacity was far greater than the typical person that was going in. And we wanted to prove that this observation that we were seeing with the patients we were seeing actually held true. The study we did, we pulled those patients who had stress testing prior to their cardiac rehabilitation to see what their functional capacity was. This is a very small group. We only had 17 patients in the cohort we studied, so our data is not statistically significant, but there's certainly a trend towards showing that these women, and a couple of men, are substantially more, their functional capacity is substantially greater than the average CAD patient. So what we did was we compared the women in our cohort to patients under the age of 55 that were age and gender matched. And when you look at the metabolic equivalence, which is a marker of functional capacity in stress testing, the trend showed much greater functional capacity in these coronary dissection patients than the average CAD or coronary artery disease patient.
We actually don't know the numbers because it's just been identified really more over the past 10 to 15 years. And we're seeing more and more cases now that we're looking. So we really don't have clear numbers on the incidence of this condition. It actually doesn't go against the normal dogma of how a heart attack presents, except the population is really the big difference. So these are young, healthy women and some men who basically have few, if any, risk factors for heart disease, but then they do present with chest discomfort. And in many of our cases, they were actually either turned away from a medical system or it took a long time to make the right diagnosis because they don't look like the typical picture of a heart attack. In some cases it is. Actually, probably about 20% of the patients in our series had an event either associated directly with or in close proximity to strenuous physical activity. 4 of our women in our series actually had cardiac arrest in the setting, and all of them, thankfully, because they're our patients, received immediate CPR. So another huge public health message is just teaching hands-only CPR to everybody who's watching this. We saw a patient last week, 34-year-old, healthy, athletic woman, runner and hockey player, who developed discomfort in the setting of skiing with her family and went into the emergency room with more back but some chest discomfort and was told it was a pulled muscle and was sent home and actually had a cardiac arrest in the car with her husband. Thankfully, he knew CPR, which is critical, and the police resuscitated her. But she came to us for an opinion. She's from another state. Certainly, we want to learn from that. Sometimes the young women do have symptoms that aren't the classic symptom of, elephant on the chest, but I think that the care providers always need to have in the back of their mind, you need to exclude a cardiac diagnosis first. And if you've done that, then you can look at other things. But I think they need to remember that rule.